This video will explore kidney transplantation. A kidney transplant is an operation that places a healthy kidney from another person into your body. The kidney may come from someone who has died, known as a deceased donor transplant, or from a living person, who may be a close relative, a spouse, or a friend. It can even come from someone who wishes to donate a kidney to anyone in need of a transplant. On the plus side, there are fewer limits on what you can eat and drink, but you should still follow a healthy diet. Your health and energy should improve. In fact, a successful kidney transplant may allow you to live the kind of life you were living before you got kidney disease. Studies show that people with kidney transplants live longer than those who remain on dialysis. On the minus side, there are the risks of surgery. You will also need to take anti-rejection medications for as long as your new kidney is working. These medications can have side effects, such as a higher risk for infection and certain types of cancer. Although most transplants are successful and last for many years, how long they last can vary from one person to the next. Many people will need more than one kidney transplant during their lifetime. Some people undergo a preemptive transplant. This means someone has gotten their transplant before they needed to start dialysis, and they avoided it altogether. Getting a transplant not long after the kidneys fail, but with some time on dialysis, is referred to as an early transplant. Both of these have benefits. Some research shows that a preemptive or early transplant can lead to better long-term health. It may also allow you to keep working, save time and money, and have a better quality of life. So who can get a kidney transplant? Kidney patients of all ages, from children to seniors, can get a transplant. You must be healthy enough to have an operation, and you also must be free from cancer and infection. Every person who's considered for a transplant will get a full medical and psychosocial evaluation to make sure that they are a good candidate for that transplant. The evaluation helps find any problems so they can be corrected before transplant. For most people, getting a transplant can be a very good treatment option. In many cases, people who are older or who have other health conditions like diabetes can still have successful kidney transplants. Careful evaluation is needed to understand and deal with any special risks. You may be asked to do some things that can lessen certain risks and improve the chances of a successful transplant. For example, you might be asked to lose weight or to quit smoking. To get a transplant, you will need a healthcare provider to refer you to a transplant center for an evaluation. They will give you a complete physical exam, review your health records, and order a series of tests and imaging to learn about your overall health. Everything that can affect how well you can handle treatment will be checked. The testing is very thorough, but one thing you can do to speed up the process is to get some of this testing done as quickly as possible and stay in close contact with the transplant team. If you know someone who would like to donate a kidney, that person will also need to go through screening to find out if he or she is a match and healthy enough to donate. But what about the surgery? Well, you may be surprised to learn that your own kidneys generally are not taken out when you get a transplant. The surgeon leaves them right where they are, unless there's a medical reason to remove them. The donated kidney is placed into your lower abdomen, where it is easiest to connect it to your important blood vessels and to your bladder. Putting the new kidney in the abdomen also makes it easier to take care of any problems that might come up. The operation takes about 4 hours. You'll be sore at first, but you should be out of bed in a day or so and home within a week. If the kidney came from a living donor, it should start to work very quickly. A kidney from a deceased donor can take longer to start to work, maybe even 2 to 4 weeks or more. If that happens, you may need dialysis until it starts working. After the transplant, you'll need to start taking anti-rejection medications, also called immunosuppressants. This is to stop your body from attacking or rejecting the donated kidney, which your body would recognize as foreign and would attack and destroy without the medications. To decide if a kidney transplant is right for you, discuss further with your healthcare professional.
Interested in learning more? Visit the National Kidney Foundation of Illinois' website today.